today we are honored to have a remarkable guest who is a leading laparoscopic and endourologist surgeon and member of the Association of the Urologists of the Republic of Kyrgyzstan, and he is the PhD holder in medical science.
During medical school, surgery it combines science, precision, and direct impact on patient's life. It's one of the famous and more faster and safety methods of operation. Special small punctures in the abdomen with camera and instruments. But every day we often together. It's reconstructive and laparoscopic surgery are more challenging. Fine motor skills, patience, and a lot of year of practice. Never stop learning and never stop doing your practice every day. I don't know how to answer this question, but I think, for example, these tools makes our operations more faster, easier, and for patients more effective.
What the best thing and the hardest things about being a urologist? Till now, how many surgeries you have done?
Every day in our urology center we have from 15 to 20, sometimes 25 operations per day.
Tea or coffee, which you prefer before surgery? If not a surgeon, what will you choose? Any advice you give to the audience and especially students of KSMA? Hello everyone, welcome back to another episode of MedCast KSMA. I am your host Yamman Muhammad, and today we are honored to have a remarkable guest, Dr. Akylbek Sultan, who is a leading laparoscopic and endourologist surgeon and member of the Association of the Urologists of the Republic of Kyrgyzstan, and he is the PhD holder in medical science. Thank you so much, sir, for giving your precious time.
Thank you for having me, Yaman. Hello everybody.
Sir, you known as one of the leading laparoscopic and endourologic surgeon in the Kyrgyzstan. Before we discuss about your professional work, could you share a bit about your journey, that what inspired you to choose medicine and especially surgery, and how you found your path into urology?
Yeah. My journey into medicine starts with a big interest on human body and the desire to help people. During medical school, I realized that surgery it combines science, precision, and direct impact on patient's life. Urology fascinated me because it combines a wide range of procedures, from endoscopic to laparoscopic and reconstructive operations.
Okay, well, so you specialize in endourology and laparoscopy surgery. Could you explain the difference between both of them and these two approaches for students?
Yeah, endourology and laparoscopy. It's one of the famous and more faster and safety methods of operation.
Yep.
Endourology is performed inside the urinary tract through natural passages. For example, removing stones through urethra without any incision on the body. Laparoscopy, in other hand, is done with special small punctures in the abdomen with camera and instruments. For example, endourology is better for kidney stone diseases. Laparoscopy is best for tumors and reconstructive operations.
Okay. Many students, including myself, confuse urology and nephrology. You also in the first lecture explain us the difference between both of them. Will you explain the difference between both of them?
Of course, it's a great question. Urologist is a surgeon. We treat kidney diseases that require more often surgery methods. For example, stone diseases, tumors, or prostate problems, etc. Nephrologists, on other hand, they treat medical kidney disease, for example, glomerulonephritis or kidney failures. But every day we often together. For example, I fix the blockage and nephrologist help us to recover the kidney function.
It means that when you are doing surgery, nephrologist is also in that room.
Yeah,
Yeah.
every day just our urologist main question is find the blockage or obstruction in urinary tract, and we do some operation. Usually it's operations, say 80% is operation. After that, nephrologist recover kidney function.
Okay. You perform a wide range of surgeries in endourology and also laparoscopy. Which one are the most technically demanding?
Uh, it's very big, and mm, we can ask different with different answers.
Yeah.
But my mind, it's reconstructive and laparoscopic surgery are more challenging, are the most challenging. Why? Because they need more fine motor skills, patience, and a lot of year of practice. For example, laparoscopic surgery needs spatial understanding of anatomy. For example, open surgery and laparoscopic surgery, when you're teaching anatomy, it's some different. Spatial anatomy and patience. The key of good operation or good skills is long life learning, never stop learning, and never stop doing your practice every day.
Yes. Yeah. Uh, Before we go further, which one is your favorite in both of them, laparoscopy or endourology? Which you prefer?
Um, I don't know how to answer this question, but I think every operation have own details, and for me, exact my mind, it's endourology. I think it's more easier. For example, when you doing all high quality operations, for example, in endourology, highest quality it's percutaneous nephrolithotripsy. We have some types of operation, standard PCNL or mini PCNL. When you do puncture to kidney, I think it's more hardest. Next, it's operations on prostate gland. It's I think it's easy operation. My opinion, it's laparoscopy operation. It's more difficult. Endourology is easier, I think.
Okay. What are the some recent innovations that have changed your practice?
Um, for example, for today, most modern operation, for example, on kidney diseases, kidney stone diseases, it's a flexible ureteroscope. Flexible ureteroscope, laser technology, and 3D laparoscopic systems. These tools are make our operations more easier, faster, and for patients more effective. Post-operative period is more shorter than open surgery. Flexible ureteroscope. We're using flexible ureteroscope, laser technology, 3D laparoscopic systems. For example, these tools are makes our operations more faster, easier, and for patients more effective. Why? For example, operations on kidney stones. Before, our teachers, surgeons, they doing open surgery. For rehabilitation of patient, it takes, for example, 1 week. After this modern operations, it takes only 1 day. After flexible ureteroscope operation, only 1 day. That's why it's a gold standard all in the world.
Uh, what the best thing and the hardest things about being a urologist?
The best thing I think every day just improving patients' quality of life. I think it's a main aim of every surgeon. Gynecology, it not depend which department, urology, gynecology, general surgery. Every day improve patients' quality of life. The hardest thing, I think it depends on for all doctors. It's a high emotional pressure and the long working hours. But when you see good results of patients, you forget all these problems.
Okay. Uh, what advice would you give to a young medical students who dream of becoming surgeon, including myself?
Uh, I think I'm not ideal variant that gives some good things for young doctors. But for example, about my journey, it was long journey to to do operation. Yeah, because our elder colleagues they uh, just control you before operation. Any operation, your first operation, they control you and see can you do operation or not. And at first, I think it be patient every day. Do not stop learning. Uh, mm, Consistent. Yeah, I think this one. And surgery is like before I said that surgery is a long journey. It's about skill, mindset, and discipline.
Okay. As I mentioned in the starting that you are the member of the Association of the Urologists of the Republic of Kyrgyzstan. So, what opportunities this bring to you?
Session of urologists in Kyrgyzstan. It's a very good platform for professional growth. Every month we discuss some difficult clinical cases, urologists from all our country, um, and we share experience, attend on workshops, and of course we collaborate with international colleagues. Um, it helps us to keep Kyrgyz urology aligned with the global standards.
Okay. There is one question. If you want to give the answer of it, do you remember till now how many operation surgeries you have done?
Mm, yeah, man, I think I don't remember a lot of operation I did. Um, maybe in total,
Yeah, in total,
maybe um, 500 maybe operation,
average
maybe
500,
1000.
1000.
Yeah,
So they are laparoscopy and endo
yeah,
urology.
together.
Okay.
As you know, our country just amount of patient is very not very big. Every day in our urology center we have from 15 till 20, sometimes 25 operations per day. Um, but of course, our population is very low. That's why not a lot of amount. But for example, endourologic operation, I think 100% we can do any operation. What we have now in modern urology, we can do any operation that we have.
Okay. Uh, at what year you start doing your surgery?
Sorry,
From which year you start surgery?
which area?
Year
Ah, Yaman, from 2017.
2017.
Yeah. For
Okay.
example, from 2017, it was only open surgeries
Mm.
because in our urology center we have just similar equipment. Yeah. After 2000, 2020, 2022, we have modern equipment, and now we do anything, any operation.
This is the important information which I should have to ask, but I forget. Thank you so much for this. Finally, last question for this. What are the core values every successful surgeon should have?
As you know, Yaman, medicine changes every day.
Yep.
That's why every day we need to learn. Yeah, it's a lifelong learning, discipline, and patience. Because, for example, laparoscopy surgery, it for doing laparoscopic surgery, you need to have a patience because it was very just short movements and but operation same operation. Yeah, in open surgery you can just doing very long cut, but in laparoscopy you cannot do this one. Yeah, this and main is a discipline.
Okay. All right, sir. Now let's move to our rapid fire round. You can answer in one or two words or sentences. Let's make it quick and fun.
Okay.
Okay. Uh, First question. Your favorite surgical instrument?
Laparoscopic needle holder.
Okay. The most memorable surgery you have ever performed?
My first laparoscopic pyeloplasty.
One quality every good surgeon must have.
Patience, discipline, and hard working every day.
Okay. Why patience and
Uh,
discipline?
Patience because endoscopic and laparoscopic surgery need patience. Why? Because uh, on monitor it's a big movements, but in fact inside the patient, inside abdomen, it's very short movements. That's why you need to. It's by millimeters, moving by millimeters.
That,
That's why I think it's patience
all
and good
right.
motor skills.
All right. Uh, Tea or coffee, which you prefer before surgery?
Coffee.
Coffee. Ah. If not a surgeon, what will you choose?
Minister of Health.
Uh, your favorite way to relax after the surgery or after a busy week?
Hiking and family time.
Okay. One book or movie which everyone should watch or read?
Film Doctor.
Doctor. Doctor. Yeah. Uh, any advice you give to the audience and especially students of KSMA?
Advice for students: everyday hardworking, discipline, and never shy to give question to your teacher or mentor.
That's important.
Yeah.
Okay, sir, thank you so much for giving your precious time and joining us today. It was truly inspiring to learn about your journey, your patience for surgery, and your dedications about inside and outside the operation room. Your insights are not only valuable for medical students, but also for anyone who dreams of becoming a skilled and compassionate doctor.
Of course, thank you for this inspiring conversation. It was pleasure to share my experience with future doctors. I wish you everybody success and dedication in your medical journey, and never give up. Take your aim and just do it.
Once again, thank you so much, Dr. Akylbek Sultan, for being with us on MedCast KSMA. To our listener, stay tuned for more inspiring conversations with the brilliant minds shaping the future of medicines. If you enjoyed this episode, please like, share, and subscribe to our YouTube channel. Thank you so much.